Flu causes, symptoms, treatment, and prevention. Good day, everyone. Today we will discuss the flu, a highly common illness, especially during cold weather or seasonal changes. The flu is a contagious viral infection that can range from mild to severe. If not treated promptly, it can lead to serious health complications. So, what is the flu? What are the symptoms and how can we prevent it? Let's find out. 1. What is the flu? The flu, also known as influenza, is a viral infection that primarily affects the respiratory system. It is caused by the influenza virus and spreads rapidly from person to person, mainly through respiratory droplets when an infected person coughs, sneezes, or talks. The flu can cause a variety of symptoms, ranging from mild to severe, and in some cases, especially in the elderly, young children, or those with weak immune systems, it can result in life-threatening complications. There are different strains of the influenza virus, and new strains appear every year, which is why flu vaccines are updated annually. The main types of flu viruses are A, B, C, and D, with types A and B causing seasonal epidemics. 2. Flu symptoms. Flu symptoms typically come on suddenly and can be more intense than the common cold. Some common symptoms of the flu include high fever, typically ranging from 38 to 40 degrees C, accompanied by chills and fatigue. Headache, severe headache that can affect concentration and daily activities. Body aches, pain in the muscles and joints, especially the back and legs. Fatigue, a feeling of tiredness and lack of energy that can last for days or even weeks. Coughing, sore throat, and stuffy nose. These are typical symptoms, often accompanied by dry cough or phlegm production. Shortness of breath. In some severe cases, the flu can cause difficulty breathing, especially in those with underlying health issues. Additionally, individuals may experience nausea, vomiting, or diarrhea, particularly in children. Flu symptoms typically last between 3 to 7 days, but fatigue and coughing can linger for weeks. 3. Causes of the flu. The flu is caused by influenza viruses that are highly contagious. These viruses can be spread through the air when an infected person coughs, sneezes, or even talks. You can also contract the flu by touching surfaces that are contaminated with the virus and then touching your face, especially your eyes, nose, or mouth. Certain groups are at a higher risk of contracting the flu and developing severe complications, including children under 5 years old and adults over 65 years old, pregnant women, people with pre-existing health conditions such as diabetes, heart disease, asthma, or weakened immune systems. Additionally, the cold weather and changing seasons create favorable conditions for the flu virus to thrive and spread. Crowded places such as schools, hospitals, and offices are also common settings for the flu virus to spread. 4. Treatment and prevention of the flu. While the flu can often be managed with supportive care, it is important to treat the symptoms early to prevent complications. Here are some treatment and prevention methods. Treatment of the flu. Antiviral medication. If flu is diagnosed within 48 hours of symptom onset, doctors may prescribe antiviral drugs such as oseltamivir, Tamiflu, or zanamivir. These drugs can shorten the duration of the flu and reduce the severity of symptoms. Pain relievers and fever reducers. Medications such as paracetamol or ibuprofen can help relieve headaches, muscle aches, and fever. Rest and hydration. Getting plenty of rest and drinking fluids helps the body recover faster and stay hydrated, preventing the flu. Flu vaccination. The most effective way to prevent the flu is to get the flu shot each year. Vaccines are updated annually to protect against the most common strains of the flu virus. Hand hygiene. Frequent hand washing with soap and water is one of the simplest and most effective ways to prevent the spread of the flu virus. Wearing a mask. Wearing a mask in crowded places or when in close contact with someone who is sick helps prevent the virus from spreading. Avoid contact with sick individuals. Avoid close contact with people who are showing symptoms of the flu to reduce the risk of getting infected. Boosting immunity. A healthy diet, regular exercise, and adequate sleep can strengthen your immune system, making it more resilient to infections like the flu. 5. Conclusion. The flu is a common illness, but it can lead to serious complications if not treated properly, especially for those at higher risk. By getting the flu shot, maintaining good hand hygiene, avoiding contact with infected individuals, and living a healthy lifestyle, you can significantly reduce your chances of getting sick. If you develop flu symptoms, it's important to rest, stay hydrated, and seek medical advice early to manage the illness effectively. Thank you for watching this video. If you found this information helpful, please like and share it with others, and don't forget to comment on the topics you're interested in for our future videos. Stay healthy and take care.